It's very overwhelming.
Elise Hill has spent the entire pandemic juggling her work, caring for her toddler, and house chores.
I have to work during his nap times or when he's sleeping.
The Ontario mom was at the tail end of her 18-month mat leave when the pandemic began.
I made the decision along with my husband that I would, while working from home, also care for my son because we weren't comfortable putting him in daycare. And that choice has definitely been challenging.
She says lockdown mandates and distancing from family, friends, and other kids has made caregiving more difficult.
It's a lot, and that really contributes to caregiver burnout, which I've definitely experienced personally.
Clinical psychologist Alani-Verjee says caregiver burnout has been more evident during the pandemic.
Caregiver burnout has been extremely real for so many people. It's those multiple demands, but it's that emotional need to take care of others.
Many people associate caregivers as healthcare workers or people who take care of those who are ill.
We can also talk about it in terms of teachers. We can talk about it in terms of support workers, the folks who are at home who aren't necessarily even taking care of an ill family member, but simply family members who require care.
Alani-Verjee says caregivers often feel burnout when they're stretched beyond their capacity.
When our empathy, our desire to help, and our need to take care of other people is the thing that is exhausting us and the thing that is stretching our capacity to the point where it can't stretch anymore.
Christiana Aggie, Executive Director of Alexis Lodge Retirement Residence, a memory care facility in Ontario, has been working with dementia and Alzheimer's patients and their caregivers for 23 years. She says it's important for caregivers to take a step back and evaluate their own health.
Be tuned in into the signs and symptoms of caregiver burnout, because a lot of people don't even know it's happening. They become so irritable, they become fatigued, even to the point of depression.
Part of Aggie's job includes offering education and awareness to caregivers to help them avoid burnout and exercise self-care. Tips she says every kind of caregiver can benefit from.
When you are depleted and you have nothing else to give, you both suffer. It's important that caregivers reach out for help. Take mental health breaks, at least 20 minutes a day. Be away from that environment. Healthy eating, adequate sleep, exercise is really important. It's good to look for resources out there in the community.
And finally, she recommends caregivers go easy on themselves.
Caregiver guilt is really difficult to handle because you don't think you are doing enough.
Sharmeen Somani, Global News.